3, 2, 1.
Good evening. I'd like to provide you with a short update on the critical work we've been undertaking on testing to better understand the spread of coronavirus in our community and to assist in deciding how and when we take steps to ease lockdown. I'd like to start by setting out the daily results on our testing and healthcare capacity. So we've tested 2,801 samples for COVID-19 and have received 2,466 negative results and 286 positive results. Of those with positive results, 42% are male and 58% are female. The average age of those who've tested positive is 54, and the results of 49 tests are currently pending. 197 islanders have now fully recovered from coronavirus, having originally tested positive. Of those who've recovered, 42% are male and 58% are female, and their average age is 48. 70 islanders are currently being treated in the General Hospital for a range of medical conditions. Of those, the number of coronavirus patients is 9. There are 127 beds currently available in the hospital, giving us an occupancy rate of 36%. The number of islanders who sadly died as a result of this pandemic is now 23. Of those deaths, 12 were confirmed through laboratory testing as being COVID-19 deaths, and 11 were presumptive coronavirus deaths. A total of 13 deaths took place within hospital care, 11 in the General Hospital and 2 in St Saviour's Hospital. Outside of the hospital setting, 9 deaths have occurred in island care homes and 1 within an individual's own home. 38% of those who sadly died were female and 62% were male. 1 of those who died was aged 50 to 59 years, 2 were aged 60 to 69, 7 were aged between 70 and 79, 7 were aged between 80 and 89 years, and 6 were aged over 90. Looking at testing, from Monday we will be doubling our capacity to swab test islanders, which shows whether you're currently carrying the virus or not. The most urgent tests will be processed on island in our own laboratory, and we'll be reserving most of those tests for hospital admissions. The remainder will be processed at Colindale, which is the laboratory we're using in the UK. But we are working hard to continue to increase our PCR testing capacity to an average of 500 tests a day, and I hope to be able to update you that we have secured this in the coming week. Now, the capacity for 500 tests a day will mean we can swab all hospital inpatients, referrals from GPs, residents returning to care homes, and all symptomatic islanders, including our essential workers. Tests will also be done proactively for health and care workers, blue light personnel, prison and funeral directors. And where we find evidence of COVID in a care home, we will have the capacity to test all staff and residents quickly to try and detect and try to control clusters of cases. With this new regime, we expect to see an increase in confirmed positive cases, but it is important that islanders understand that our statistical model already assumes that many unconfirmed cases exist. More testing will allow us to identify the details of these cases. Now, to ensure we actively follow up each positive case, our environmental health team have doubled their capacity and will continue to grow as needed in order to undertake proactive contact tracing. Now, this weekend, we will also be launching our COVID-19 community antibody testing program. And yesterday, we began contacting randomly selected households by letter and phone, inviting them to take part. This test measures the level of antibodies in our blood, which are produced when the body successfully fights a disease. And I urge all islanders who receive a letter or a phone call to take part and help keep our community safe. Anyone who is contacted and would like to take part can book an appointment to have their first test between Saturday the 2nd and Tuesday the 5th of May. Testing will be available at 3 testing sites at accessible locations across the island. These exact locations will be confirmed when the contact is made. The test itself uses a drop of blood, which is taken with a small pinprick. Each person taking part will get the results in about 10 minutes and receive a fact sheet explaining the result and what it means. So the tests are being conducted to help estimate the spread of COVID-19. The 500 households who take part, which is roughly 1,500 islanders, will be tested every 4 weeks. And this repeated testing will allow researchers to establish how the virus is moving through the community. Results from the tests will be recorded into a database and then will be anonymised before sending to Statistics Jersey. And the data will be used by Statistics Jersey to create an island-wide picture of the COVID-19 spread, which will be publicly available. Now, current estimates suggest that the stay-at-home and social distancing measures have been successful in stopping the spread of the virus, and we believe only a small percentage of islanders have been infected with COVID-19. Now, community antibody testing will check our assumptions and produce data that can be used to decide when the island can begin to move through the phases of safely relaxing the current lockdown measures. And in a press conference tomorrow, I'll be speaking in detail on this phased approach, which will provide a framework for us to begin safely moving towards a safe exit from lockdown. And that press conference will be available to watch on our social media channels and will be broadcast on the radio through BBC Radio Jersey and Channel 103 at 2 p.m. And I would encourage you all to tune in as we set out the plans for the next phase in tackling this crisis. Thank you for taking the time to listen, and I look forward to speaking to you again tomorrow.